Well, we're finding out this morning just how many Canadians have been able to access dental care through the government's National Dental Care Program. The federal government says more than 1 million people are now receiving care through the plan or the CDCP. The next step is opening up the service to all remaining eligible Canadians by next year. And for more, Canada's Health Minister, Mark Holland, is joining us in studio. It is interesting we are talking about dental care on the day that children, millions of them, are going to consume tons of candy throughout the night. Welcome to your morning.
Yeah, thank you. Great to be here and great observation.
Okay, so 1 million served. The goal, I believe, is 9 million Canadians having access to this plan by next year. One of the new things in this plan is that they're going to begin considering requests for pre-authorization care for things like crowns and partial dentures. But dentists say there's still a lot of confusion over who can access it, and they flag that there's still not enough dentists to meet that goal of 9 million Canadians being served. How are you going to address that?
Well, imagine, so first of all, 1 million people in 6 months. I mean, this blows away, I think, even our most optimistic expectations. To put it in context, that would be filling the Scotiabank Arena 53 times. That's how many people have gotten care in this country and been connected to services they really need. This is essential care. And the number of folks that are participating now, 89% of oral health professionals. That's 22,300 across the country. We're introducing paper claims tomorrow. That'll accelerate those numbers even more. So we're going to get to 100%. And, and I'm very confident we're going to be able to see everybody. Right now, we're seeing folks 65 and older and 18 and under. In the coming months, we'll be rolling out the rest of the country. But, this is not just a matter of having a healthy, happy smile or getting dentures in your mouth if you're a senior. It's also a matter of prevention. And you look, we spent about $2 billion in ER visits for oral health issues that shouldn't be there. We have the chance to save a boatload of money doing this at the same time as giving people happy smiles.
But you and I both know dental care, it can also be emergency dental care, right?
Yeah.
And when you need something fixed in your mouth, you can't have a long wait time. So if there's not enough dentists to sort of reach that 9 million person need, then we're looking at longer wait times. And then so the service doesn't necessarily always work for everybody.
Well, right now, if we take a look at seniors, we almost have all the eligible seniors participating, right? So we have about 2.7 million people in total who've registered. We have 1 million people who've gotten service. The folks that I'm talking to are getting service right away. And I'll tell you, these are people who had no access to care before. So what was happening before the dental care program, somebody'd have a pain in their mouth and they don't have any money to deal with it. They put it off, they wind up in an emergency room. Now, and by the way, that's huge money and major inconvenience and potentially a catastrophic health outcome. Now what's happening, they get to see the dentist early. They say, hey, you got a problem in your mouth. Talking to Dr. Redmond out in Gander, 3 cases, oral cancers found in people's mouths that came in through this plan that would not have otherwise been discovered. Imagine, that's just one clinic, right? What about the people who are being found out to have diabetes because they came in? The person who hadn't seen a medical professional at all because they didn't have coverage and thought, well, I got to go, got a pain in my mouth. They come and get their blood pressure checked, find out that they're hypertensive. So this is about prevention. And the situation that you're talking about, this plan prevents because finally people are being connected to care. These are people who had no access to care before.
On the flip side of this, there are people who are saying, this sounds like something I want access to, but they don't fit the eligibility requirements, right? So that depends on a number of factors, including how much money you make. A report from the Canadian Centre for Policy Alternatives says that 4.4 million uninsured Canadians aren't going to be able to access this plan because they don't meet the financial threshold. And a reminder to everybody, for 100% coverage, it's less than $70K. To get 30% coverage, it's $89K or less. So how are you going to address the gap of Canadians who want access to these great things that you've just told me about, but they're not financially eligible?
Well, because we keep moving that conveyor belt of progress. Look, this isn't just about dental care. This is about what we're doing on pharmacare, and we could have a whole separate conversation about that, or school food, or what we're doing with health data, or what we're doing in primary care with bilateral agreements. We are looking to change our entire health system from a crisis-based system to a prevention-based system. If you can imagine What's that?
It's cheaper to do it that way.
Oh my goodness, so much cheaper. You know, 70% of what's filling our hospitals, ER rooms, and doctors' offices doesn't belong there. It's preventable, right? So we have the power to have a healthier, more productive society. That means we need to get upstream. And that's what this dental care plan is about, identifying things early so they don't become massive problems. Now, I agree, this is such a wonderful problem to have. We are getting so many people connected to care and it's working so well. People are looking and say, well, I want better care too. I'm with you, and it's a journey. We got to make that progress one step at a time. 1 million people in 6 months. That's huge progress.
You brought up doctors' offices, and I'm so glad that you did. We know that 3 provinces just wrapped up provincial elections where healthcare was in the top 3 concerns, #1 in a couple of those. You know, we asked the New Brunswick Premier Designate Susan Holt on your morning last week if she would consider doing something that Ontario has done. So you know that Ontario Premier Doug Ford has brought in Dr. Jane Philpott, who used to have your job, to advise on getting primary care and physician access to Ontarians. So we asked the Premier Designate in New Brunswick if she would consider that. Here's what she had to say.
Oh, look, when we saw that, we were jealous. I thought, shoot, I would have loved to have grabbed Jane for New Brunswick, because she's been doing amazing work at my alma mater.
We know that healthcare is a provincial issue, but also national as well. Is this something that the federal government would consider, bringing Jane Philpott, Dr. Jane Philpott, back to consult on how do we fix the doctor access?
Look, I'm looking forward to meeting with Jane in her new role. I think it's wonderful that she's there in Ontario. And we need a spirit of total cooperation and collaboration. We know what we have to do. We've got to stick to the data, the science, the evidence. We need team-based care. We need to be upstream and focused on prevention. And look, I think we've got a great relationship with provinces right now where we're focused on trying to make things better. And we've got some differences, but provinces can see when they're not partners in this, if they're not partners in that health transformation, there's a big consequence electorally. So, you know, I feel very encouraged right now. We're going to have a federal provincial health ministers meeting very soon. And it was going to be in Nova Scotia. They have an election, so we had to put it back a little bit. But those conversations, working with other jurisdictions, working with a whole bunch of leaders, all the different leaders that are there, it's through that collaboration that's going to get there. For a brief moment in the pandemic, we all worked together. We all moved in one direction. What we were able to do as a health system when we were all pulling in the same direction, when we set aside the egos and the boundaries and the partisanship, we were able to do phenomenal things. Here, this kind of partnership we're seeing in the dental, 1 million people in 6 months, that's huge. When you talk about the individual stories, that transformation of somebody having a smile, imagine having no dentures and then having dentures. Right? All of a sudden, they're arranging family photographs, right? They're going into a job interview with a totally different type of confidence. This is powerful, powerful stuff. This is possible throughout our health system for focused on prevention.
One last question before we let you go, and we are looking at a looming federal election, probably closer than October of 2025. Is your party ready to run?
Always. You know, this will be my 8th federal election, but I'll tell you what you do is you focus on the job you've got, and you wake up every morning making things better. And, you know, if I'm doing my job as health minister, connecting people to dental care, launching pharmacare, improving access to primary care, improving health data so that information moves seamlessly in the system, like all of those kinds of things, then I've got an easy job in the election to talk about, you know, the politics of all of that later on and the choice that people have to make.
You might not have that much later on, though.
No, true, but I mean, I don't. But you know, you never know how much time. You know, you never know how much time you have in life, right? Like, I mean, every day you wake up and you be grateful for the day that you have, and you do the most you can with it. And I think that's what's important here. You got to be focused on the moment, focused on helping people, focused on the work, focus on making things better. And, you know, there's a lot of political noise at Ottawa. That's not what I hear people want. They don't want me to engage in a lot of politics. They want me to get things done. That's what I'm focused on.
And they want a doctor. Health Minister Mark Holland, great to have you back on your morning.
Thanks so much.
If you liked that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.